I would like to call this meeting to order. Good evening, everyone, and welcome to tonight's department budget hearing. Today is Wednesday, April 17, 2024. We will have two presentations tonight from the Department of Health and Human Services and Metro Hartford Innovation Services. I am Councilman Amilcar Hernandez, and I am Chair of the Operations Management, Budget, and Government Accountability Committee. This meeting is broadcasting live on HPA-TV's Xfinity Government Channel 96 and Frontier Government Channel 6032. It will also be streamed via HPA-TV.org, the HPA-TV Facebook page, and HPA-TV Apple TV, Amazon TV, and Roku TV apps. It will also be made available on the HPA-TV YouTube channel. I would like to acknowledge my colleagues here present here today. I'll start from my right, Councilwoman Bilodeau, Majority Leader Rossetti, Council President Surgeon. To my left, Councilman Gale and Councilman Mixon. And the first presentation will be by the Health and Human Services Department, and the floor is for the Director of Health and Human Services, Director Ebony Jackson Shahid. The floor is yours.
Thank you very much, Councilman. I would like to introduce my team, Deputy Director of Health and Human Services, Dr. Jessica Forquette. I would like to introduce you to my Financial Manager, the MSO, Mohammed Corte. I would like to introduce you to my new Deputy Director of Social Services, Patricia McIntosh. And I would like you to introduce you to my Chief Sanitarian of Environmental Health, Elizabeth Kavanaugh. Thank you. Shall I do that? Okay.
You could go ahead and start the presentation.
Okay, thank you. So we're just going to start off with the mission statement of Health and Human Services. Our department aims to protect the well-being of Hartford residents, to promote an environment conducive to healthy lifestyles, and to prevent adverse health outcomes through needs assessment and the provision of quality services. Our division is divided into 5 divisions. We have disease prevention and health promotion, maternal child health, we have senior and community services, as well as environmental health and administration and grant management. Within those programs, we have, they're funded various ways. So we have some funded through general fund, some funded from grants, or the majority of our divisions are funded by grants. And then we have 2 state programs, which are WIC and Renter's Rebate. Our staff composition for the number of staff, full-time employees, we have 56, part-time 6, and 1 temporary position. For our residency, I'm sorry, let me just make sure that we're on the same page. Okay. Sorry about that. Let's talk a little bit about the 10 essential functions of public health. So those 10 essential functions of public health, or 10 essential public health services, they really serve as a framework to carrying the mission or carrying out the mission of public health. And 2020, they were revised to include equity at the center. And as a result, all the public health services aim to achieve equity by seeking to remove systemic and structural barriers that resulted in health inequalities. And so basically all of our programs that we do at the health department and in our human services department, we evaluate each program through this lens. So we see how we can do assessment, how we can do policy development and assurance, and then how is that going to affect every single individual, regardless of race, regardless of language. This is how we develop all of our programs. So let's just talk about some of our highlights for 2024. We have a fully staffed rodent control inspection unit, refining deployment of existing strategies and identifying new strategies to control the rodent population. We have submitted 5 grants. 4 have been funded thus far, and we were awaiting a decision for one of them, and we did receive the decision. So the 4 grants that we received the Safe Kids Grant, Immunization Grant, Workforce Development, and the HIV Prevention Grant, and that is separate from Ryan White, but is run by that division. The grant that we did not receive was the Teen Pregnancy Grant, so we did not receive that grant. We are applying for 2 additional grants for new funding, and it'll be submitted later this April and May. And those 2 grants, they are both CDC grants. One is from the Office of Minority Health, and that's a maternal child health grant. And the other one is a multidisciplinary HIV and aging grant, which will basically be between the Ryan White and the Senior Services Program. We are basically going to be continuing our public health accreditation application. It was accepted, and we are currently in the next to last steps to completing this 10-year journey, I'm told, towards accreditation. So we do have, I don't want to say 365 days anymore since we've already been accepted, but we have a year to upload the remainder of our standardized documents to get our accreditation, along with a visit before we receive decision. We have been restructuring some programs in the department to better serve residents. You know, I'll just give you an example of what we've done so far. The environmental division was restructured. We basically were able to up those salaries for sanitarians and add a program manager to assist with management. We basically brought in also a grant specialist that helps out with grant writing. Since the majority of our funding comes from grants, we want to make sure that source continues, along with training compliance for our subcontractors, because we realize that they need some assistance with training, so that person is doing that. Sorry, just want to. Also, I'm sorry. We also have a draft of a comprehensive rodent control plan for the city. So that's, you know, in the works. We will be looking to have further conversations so that we can finalize that rodent control plan. We're moving from the pandemic phase to the endemic phase as it relates to COVID-19, while continuing to respond for flu and respiratory illnesses such as RSV. We do also send out a report to administration when it comes to our respiratory illness data. If there's any data that anybody is interested in, then we can also provide that as well. We are going to continue identifying additional funding sources to expand the department's footprint in areas identified in Community Health Improvement Plan. This is honestly, our grant specialist is such a benefit for our department because he has really already brought so much information and knowledge to the department when it comes to getting additional funding. Implementing the workforce development plan with state funding, that really is a priority of the state. Right now, public health has taken a big hit all across the nation. A lot of people just have been burned out. So they really have been putting a lot of priority in really revamping public health and rebranding and giving us the tools and resources needed to do so. So we are working with them in terms, you know, for improving workforce development in public health. Implementing sexual health programs throughout our department clinic. We are doing that through additional funding. And also we do have a nurse practitioner that is on board now. In terms of our budget comparisons, you do see the change for general fund at 462, 761. That change is really just additional staffing In terms of grants, we have received some additional grants, as well as projections to grants that we already have, and projected years that we'll have them for. Some more budget highlights and areas of focus. We're working on promotion, and basically we're striving to promote from within. So any of our vacant positions that we have had, we are trying to promote from within the department first, and after that, prioritize, Hartford residents, also those who will be beneficial to the changing community. Funding, HHS continues to pursue new grant opportunities as capacity and needs arise. And in terms of social determinants of health, we are constantly finding opportunities to engage in this work through partnerships. And we honestly relish, we're very excited to continue to partner with various community organizations to make this happen. Okay. And so our staff composition for all employees, we have full-time positions 56, our part-time positions are 6, and we have a temporary position, which is 1. For residency, we have 24 for the city of Hartford, so that's 38% of our population. For non-city of Hartford, we have 39, 62%, but we do have a new employee that I would like to say who is going to be moving here from Philadelphia. So that's very exciting that we did hire someone who is going to be actually moving here from another city. For race and ethnicity, we have 16, so 25.4% are Latino or Spanish speaking or Hispanic. For African American and Black, we have 31, which is at 49.2%. And Caucasian or white is 10 at 15.9%, and Asian is 6 at 9.5%. For gender breakdown, we have female 43, 68.3%, and male we have 20 at 31.7%. And that is all I have for you this evening.
Thank you, Director Jackson Shahid. We're going to move now to ask some questions or make some statements. So I'm going to open up the floor for our council colleagues, to ask any questions. I think there's a little bit of an appetite to only do one round of questions. So let's see if we can make that happen.
Okay.
So I'm going to start from my right. I'm going to start with Majority Leader Rossetti. She doesn't have. Okay. Well, let's. Okay, we're still making decisions here. So we're going to start with Councilwoman Bilodeau. Floor is yours.
Thank you very much for your presentation and your service to the city. Because I chair the Public Works, Parks, and Environment Committee, and including Recreation, I just have a question about the rodent control program. Is there any, is it environmentally friendly for the future? Is there a plan for that?
Yeah, so actually, I will refer this question to my chief sanitarian, if that's okay.
Thank you. So, Councilwoman, I think your question is this an environmentally friendly rodent control program that we are currently using?
Currently, and if we're not currently using it, are we going to move to something that is environmentally friendly?
Yes. So I think that everyone will receive the rodent control template. It's a draft for our citywide rodent control program. We're kind of excited. We started to implement a carbon monoxide machine that doesn't sound very friendly, but it does a good job on the rats. And it is not a rodenticide. It is not a restricted use product, so it can be used over and over again without detrimental effects. We're still getting used to that machine. There's some, quirks in it. And I always want to have at least 2 people on that machine, even though it says you can use 1 at a time. We still do use rodenticide when it is applicable. We follow the Department of Environmental Protection's integrated pest management program, which requires at least 4 key components. That's a survey, a tolerance limit, intervention, and an evaluation. And in the near future, we will be implementing a CDC-developed survey tool, and it will give us a really good baseline for future work and to basically support the work that we're doing now.
Thank you very much.
You're welcome.
All right, Assistant Majority Leader Clark.
Thank you, Mr. Chair. Director Shahi Jackson, good evening. Question, within your budget, I had this conversation with your predecessor, I think last budget year, regarding mobile van services. Does this budget reflect that?
I'm sorry, can you repeat that?
Mobile van services. Does this budget reflect mobile van services? I believe there were some ARPA dollars set aside for purchase of a mobile van.
Yes, Councilman, we do have a mobile unit that was purchased. So the mobile unit is here, it has arrived. We are actually in the process right now of getting that mobile unit licensed because we cannot currently use it under the license that we have right now. The current license is only for the standalone clinic, but we are getting the mobile unit licensed.
In the operation of the van, that will be, is that going to be, the expenditure is going to be, is it grant related or is going to be out of the general fund?
Right now, it's out of the general fund, but if we are going to use it for anything else, we definitely will get grant funds for it.
Okay. And what services are going to be provided out of there?
So right now, it's going to be testing, but we would like to, do vaccinations out of the clinic. And I know that, we don't want to just hoard asset like this. So if other departments would possibly like to do health promotion out of the unit as well, we would like them to have some access to it as well. So we're just trying to make sure that, everything is up to date on it and that, we have it's fully outfitted for Wi-Fi and licensed, but that's really what it's going to be used for.
What about oral health services, oral health screenings?
I'm sorry, can you say that again?
Oral health screenings. What about oral health screenings?
Oh, oral health screenings?
Yeah.
Well, our clinic now currently does not do any oral health screenings, but if we were to, partner with another organization that possibly wanted to do oral health screenings and, the van is licensed, then that is a service that we could provide if we, we're working with another organization, but our clinic does not do that currently right now.
Okay, thank you.
You're welcome.
Majority Leader Rossetti.
Thank you. Hi. First of all, thank you for talking about promote from within. That's so very important. As someone in my younger years often watched other people come in and get jobs when you knew that there were people within. So thank you for doing that. I had the rodent question. Maybe you can explain this one to me, and it's probably explainable, but I don't understand it. On 27-4 in the budget book, page 27-4. Regulated barber shops and salons. I know the numbers are all over the place, but then we do adopted, projected, but then estimated in 2025, we go down to 94. What's the, reasoning behind that?
Sure, I'll refer that question to my chief sanitarian.
Councilwoman, could you please repeat the question?
So if you look at, on 27-4, regulated barbershops and salons, it's
Yes.
probably halfway down the page.
Right.
The numbers, except for 2023, are pretty consistent, but then in 2025, estimated it's only 94.
Right.
And I'm just, does it mean, I'm just wondering what that means.
So do you want me to take it or you want to?
Yes, please.
Okay. So basically, a lot of these numbers, when you're talking about regulated barbershops and salons, so there's an issue at times, or when it comes to municipalities, some of the barbershops or salons, when it comes to zoning, when it comes to actually recognizing what the shop is actually doing, and how it needs to be licensed, is different. So we could have a braiding hair salon, right? People think that it's a salon just because it has the name salon in it, but then it may not have to have the same inspection that a, regular hair salon needs. So sometimes, in terms of what we can inspect, or what we are, supposed to inspect, it may change the numbers a bit.
So, but by these numbers, and I know we've had a lot of discussions before you over the last couple of years about this, but does that mean that all of a sudden we're deciding to categorize, because, it's down by so much, them into different categories? Is that what we're doing?
That could be, yes.
Can I find out?
We could actually give you the exact breakdown if you'd like, so we
Only
can
because
provide
we're
you with that
really trying
information.
hard to your point, for the people who maybe aren't licensed and, the safety of the people working there, the other things, so just, what does that mean? And, just, I'm concerned about it, that's all.
Okay, so we can have that complete breakdown for you,
Okay,
yes.
thank you very much.
No problem.
Council President Surgeon.
Thank you, Mr. Chair. Thank you very much for your presentation. My interest is our senior centers. We have two senior centers, north and south. And I was looking at the Excel spreadsheet. I'm trying to find on the senior and community center service. What line item is for the senior centers? Is it the resident support service? I'm just trying to figure out what line item that is.
So senior services, so if you go to program services, I think it's on 27-6. There's a whole section that says,
I do see that, and I do
Yeah.
see, it's about $2,812,000. But for a budget breakdown, for that 28,112, which one is, yeah, I know, but where is, I know that, but what I'm trying to find is where I found it, but I'm trying to find which line item. I know we have $2,812,000.
yes.
But is all of that going to senior centers? I mean, I'm looking at it, and I know the senior centers are outsourced. One to
Yes.
Blue Hills and one to Catholic Charities.
Yes.
How much of this 28 million goes to them? That's what I'm
Oh, I
trying to
see what you're saying.
Yes.
So, so senior and community services, there are a variety of different programs under that particular division.
Yeah.
So in terms of a breakdown on how much money actually goes to each senior center, we would have to, give you that breakdown. But as of right now, it just shows that it's, under one division. But we can give you the exact breakdown of how much each senior center is getting.
I'm wondering if it's the other technical and professional service, which is like 865,000.
We would have to get back to you on that.
Okay. The reason why I ask is, over the last several years, we always put a couple additional funds because the seniors take trips. Coming out of COVID, they were locked in, and over the last couple of years, we have funded, so that's why I'm asking this 865, how much of that goes to the center, so we can see if there is any funding there for them to take trips.
Okay.
How do you break out this 865, which I think is other technical and professional service? I think that's the line item what 865 is.
Well, I do know that the senior centers did receive this year some additional funding, ARPA funding for the aging. So each of the senior centers were able to get some additional funding for programming. So if a senior center felt like they wanted to prioritize trips with their funding, then they were able to do that, or if they wanted to purchase something for the senior center, that was also approved as well. With each of the senior centers, if they want or need additional funding, you know, we are encouraging them to talk with the grant specialist, because we can always write for additional funds as well if we want to, you know, do a specific program. I also know that we're also doing a study right now that was funded as well for one of the senior centers. So, excuse me. Okay, it's actually called T-Dice. So it is a kind of like an exercise program for seniors, and it actually is supposed to track the activity level and increase brain activity. So that's very exciting. A lot of the seniors seem to really enjoy it. So I think we also want to do more programming like that as well.
I believe Councilwoman Rosado was the one who introduced that last year, right?
We're
Yeah.
getting some really good feedback about that program.
Yeah, so you can tell her more about that. I'm sure when her question comes up, she will ask you about that. So, all right, I'm only going to do a one question since everybody's looking at me. Oh, you got three? Oh, he's got three questions. It's going to be short questions? Oh, okay. He doesn't know. Now, we had also, in the budget, I mean, last year, you also had additional funds to hire inspectors, you know, for nail salon and all that. How many did we, I'm trying to look in the book and see how many new inspectors did you have in this year's, from last year's budget?
So we did hire a temporary inspector to particularly work on the nail salons, and so we had, you know, that assistance, so that was great. And we also have a new sanitarian EHS employee starting as of next week. So we have improved with, you know, some of our environmental staff. I think also what we were able to do as well is boost salaries for retention. When I came in, our salary bracket was fairly low for environmental, and we really weren't able to compete with the market. So we really were able to raise that. So really, I would really like to just say an appreciation to HR. That was really gave us all the tools we needed to be able to raise those salaries. So now we don't really hear any grumblings about anyone leaving. So we're really excited about that. And we're also getting people that want to come into Hartford and work. So I think that that's, you know, that speaks to the work that we've done.
Awesome. Well, I do have to commend your department. There was a great article a couple of weeks ago with the rodent guys. That was totally cool. Are they here? Or we should have brought them so we could have, you know, enjoyed and given them
Well,
a hand.
Liz is here.
That was a great article, and they seemed like they were out there, you know, doing a really super job, you know, with a lot of the garbages that are, you know, in the big containers.
Well, thank you.
So please tell them I saw the article, and they did a really great job in that article.
Thank you so much.
That's it.
Before I move to my left, Councilwoman Rosado, do you have any statements? Okay. So, Councilman Gale.
Thank you, Mr. Chair. Good evening. Sticking with the employees for a minute, in the budget book, it appears that you're budgeted for a total of 81 full-time employees. The breakdown seems to be 39 being funded from the general fund and 42 being funded, grant funded. In your breakdown on your presentation, you list a total of 56 employees. So by my math, that says that you potentially have 25 vacancies. Am I missing something, or is that the situation?
1 second. We can actually send you, Councilman, the breakdown of that if you'd like. I'm sorry, I can refer that to my Deputy Director of Health and
So we currently have 15 vacancies in the department.
I'm sorry, how many?
We currently have 15 vacancies in our department. I'm wondering if like you're looking for the people who are part-timers, and so that might be the other 10 that you're missing, so.
Well, in the budget book, they call these people FTEs, which I believe stands for full-time employee. So the budget book does say that you're being funded to have, I think if I'm reading this right, 81 full-time employees. And, you know, I'm just raising the question, it appears as though you've said you only have 56 full-time employees. That would mean there's 25.
Okay, we will look for that number and get back to you whenever we confirm it.
Thank you for reporting back, but I'm just wondering if this evening, are these vacancies affecting the efficiency of the department in any great way? And in what area you've broken down your department into, I think, 5 separate areas? Is there one area that's more affected than the other? And really, I'm asking this to try to find out whether council can be helpful.
Yes, Councilman. So I think, to be honest with you, we are doing, our due diligence in terms of hiring. In terms of a department really being affected at this current point by vacancies, I think that we do a good job at honestly providing service. If there is a department where we may need more employees, that most likely would be our environmental division. And to be honest, that's just because the total number of sanitarians that we really need should be around 12. And we do not have that total currently. But honestly, I think that with the staff that we have now and the assistance of HR to hire 4 vacancies that we do have, I think we're doing a good job at providing service.
Thank you. Back to that senior and community services area that Council President was discussing with you. I see a couple of line items there. One is for the McKinney Shelter. Can you tell us what's going on with the McKinney Shelter?
Yes, so with the McKinney Shelter, they will be moving into their new location this May. So we'll be assisting them with the move.
Where is the new location?
The new location is going to be, is that the Daisy? Brainard?
Brainard Road.
So they're currently a McKinney Shelter, the old firehouse.
Yes.
And so they purchased the hotel in Brainerd Road. So May 6th, they're going to be transferred back to the hotel. So the hotel is already prepared to receive the clients.
And is there any plans for the old firehouse then?
That's not to our knowledge. I don't know.
Okay, thank you.
You're welcome.
Councilman Mitchell.
Thank you, Mr. Chairman. Thank you, Director Jackson Shahid and team. Actually, let me just follow up on something that you just said, Madam Director. You said you really need 12 sanitarians. How many do you have now hired?
So I'll refer that to my chief sanitarian.
There's actually a bill at the state legislature, Councilman, that the name sanitarian will be changing to environmental health specialist or concurrent with sanitarian. But for now, we use sanitarians. So we currently have 4 fully certified sanitarians and 2 trainees, environmental health sanitarian trainees, who are learning the ropes and getting certified in becoming a full-time, full sanitarian. they're not unbusy, they're doing a bang-up job doing the nuisance control. And then we've hired, starting next week, a full-time sanitarian, a fully certified sanitarian, and then in May, another trainee. So that person will assist with all of the nuisance issues. So that'll bring us up to, when everyone is fully certified, 6, 7, 8.
8. So the trainees, in other words, they, at some point, they become fully fledged.
Within several
sanitarians.
years, yes.
And you need, the director said you need 12. Are you funded for 12? You have the money for the 12?
We are not.
For how many are you funded?
So I believe, and I can get back to you with the exact amount that we are funded for, but I believe we're funded for the sanitarians that we currently have as well as the trainees.
So, in
So that
essence,
would be,
8.
yes,
So you're funded for 8, but the need is for 12.
yes. And we are going, we're honestly using NACHO standards, which basically says that if you have, for every 10,000 residents, you should have 1 sanitarian. And to be honest with you, this is not uncommon in municipalities. Most municipalities do not have the sanitarians, the number of sanitarians that they actually need for the city. It's just, a lot of times it's because, you know, the credentials, it's really a lot for the credentials, so it just is one of those positions that are hard to hire for. And also, it's a position that usually is high in salary. Right now, most sanitarians are making base salary $75,000, and you know, we have municipalities that are paying upwards of $80,000 to $90,000 for a sanitarian. So it's become extremely competitive, and most municipalities are, I don't want to say we're fighting between each other for sanitarians,
You could say
but
that.
they bounce back and forth between municipalities a lot. So, I mean, I think that, you know, the sanitarians that we do have, they're doing a great job. I think that if we, you know, once we move in with the trainees and they become sanitarians, which Liz is helping out with that, she is one of the only, not the only, but one of the very few FIDOs that we actually have in Connecticut, which these people are trained and given a credential by the state to be able to train sanitarians before they actually get their last credentialing inspection by the state. So Liz is actually training these individuals to become sanitarians. So we are grateful for having her here, but I'm also thinking about the future. So I'm thinking about retention. I'm looking at my department. I'm thinking about how we do have a department that has a lot of employees that are up for retirement. So I just don't want to be in a position where, you know, Liz says, you know what, Ebony, it's any time now. And then I lose a FIDO. I also lose a registered sanitarian and, you know, really not have those individuals already within my department. So I think that's really, you know, what I'm worried about as well.
Okay. So in other words, sort of a slightly longer term plan to maintain your levels. Is what-
Exactly.
Okay, thank you. On an entirely different question, during our last session as council, I know we had some talk, and I also know from immigrant advocate groups, there's been a lot of talk about making sure that our area hospitals do better with their language access. And I know Councilman LeBron and I think folks from your department were in conversation about that. And there had been a hope to get the hospitals to sort of adopt a plan to make it so that the language access was better. And I mean, I can say, because my brother-in-law, who only speaks Spanish, was in the hospital a couple months ago, and the language access is not good, right? Folks just came in and spoke to him in English, and it's, I mean, half our city speaks Spanish. You would expect it to be better. So I just wonder if you can speak to what efforts, if any, your department is undertaking in that regard to try to get our hospitals to be more responsive to our population in terms of language access.
So, you know, honestly, since we are the health department, we are, at the table with a lot of organizations that include private healthcare. And we know as much as we'd like to, be able to enforce certain things on them, the reality is we can't. But what we can do is educate them on the things that we do in our department that makes it easier for the community. So I think that, to be honest with you, just continuing to educate them on best practices is what we can do. I do know that there are other organizations, advocacy organizations, that are discussing some of these issues. Some of those groups include CADH, that's the Connecticut Association for Directors of Health. They're very big with advocacy. There are a lot of people, in that organization who are prioritizing those things, those efforts. But that's honestly what we're doing. I think they could, take a page out of our book. We try to make sure that, when we're hiring, we also, want to try to reflect the community in which we're in. I think that obviously you can't enforce that everyone's bilingual, but I think it is important to make sure that people understand the service that they're getting, so.
Yeah, and I'm not concerned about your department so much as I am about the hospitals. Let me ask, and this, you might not be able to answer this question. You say that we can't force the hospitals, for example, to have better standards in terms of providing language access. Is that because that's a state regulatory issue, or if you know?
Yes, so any private healthcare organization is usually regulated by the Joint Commission. So usually hospitals, they are, all their accreditation or that goes through the Joint Commission. So there, that could be future conversations where, you want to talk to maybe some of these bodies that regulate, healthcare. That could be a conversation.
Thanks. Sort of related, I know that, again, this is not directly what you have control over, but a lot of our residents, if they do have to, may only get their health care from the emergency room, effectively speaking, because they don't have insurance, and then, they'll get some enormous bill. And I know there's sort of a network of different funds and charities, like Hartford Hospital has this sort of fund that they can help pay emergency room bills. But I also have found that the hospitals aren't very good at informing the patients about these other sources of funds. And so it's sort of very catch as catch can. Like I'm involved with the Hartford Deportation Defense Group, and they know, right? Like we counsel those folks to get in touch with people who can pay their bill or pay part of it. But there's got to be people who don't know about those resources. I was thinking especially of undocumented folks, and I wonder if you all are doing anything in terms of information to the public to help folks in that position who get, a heavy medical bill, to sort of, is there a way to direct them to resources?
So we haven't directly been involved with those type of efforts. But that is definitely something that if a resident does come to us, and to be honest with you, a lot of residents come to us because we're the city and ask a lot of questions about healthcare. So if they do need some assistance, we do connect them to, or refer them to a service that may be able to assist them. I know most hospitals or private healthcare settings do have patient advocacy. So we would most likely, refer a resident to, that particular either department or area of the hospital to get some assistance with something like that.
Thanks. That's all I have for now.
Councilwoman Rosado.
Thank you. So, hi, how are you? First of all, I want to extend a thank you to you and your department, and you specifically, on the great work that you did for the Brain Peace Foundation with the senior, and I know Council President was mentioning that, how you guys went above and beyond, and we actually, walked this through, the contract, the insurance, every day, so that we could get this service to the senior center. And this past Saturday, Puerto Rico, China came to a seminar at Yale with the Brain Foundation with a whole bunch of neurologists that attended. And, I was proud to, even though I couldn't attend, but to see Awilda from the Senior Center attend this, and that Hartford was the first city, in the state that did bring this program, and now they have a whole bunch of cities that, want to participate. So I really thank you guys, and I commend for the hard work and going above and beyond. And through the shortage that you had, you guys got it done. My other question, I had a question on rodent, but it was answered. So on the senior side, I saw one time a flyer. I think you guys received a grant to provide seniors with like canes and specific necessity items like steps to go into their bathtubs. And so how is your outreach, your marketing with that to be able to provide it to like the elderly buildings and, senior centers? How do you market that? And is that grant still available?
So that's the fall prevention grant is still available. That runs by our public health nurse. And I know she's in contact with the senior center. The senior center's referral to us. I'm sure like if any other community member approach to us, we try to enroll them in one of the programs so they can receive their services.
Okay. So I know she's involved with like the senior centers, but do you guys do outreach like in elderly buildings and does this apply to like an elderly that lives perhaps, by themselves in a home?
So we do outreach to all of our senior centers, especially through our renter rebate program. So usually because they are like the first line of health department when it comes to seniors, they usually do outreach because they are actually in the buildings themselves. So they have all information and they do a lot of outreach to our seniors. But I do think that overall, outreach in general or outward communication, we're working on revamping that. I think that our department needs, like a communications press secretary or something, to be honest with you, because we are so forward. And our programs are, community-based, so we need to make sure that we're getting that information out constantly. So that is something that is a priority that we're working on. But we do have outreach workers that are constantly in contact with the seniors.
Okay, wonderful. And so my last question is, now that you brought up the rent rebate, so let's say I'm a senior person that I live at home and I'm not mobile. If I was to call the health department, would someone come out and fill out the renter's rebate application?
So we do not offer that service currently for renter's rebate. Now, if we had, someone who's homebound and needs a vaccination, that's a different service because we do have nurses. But our renter's rebate employees do not go into seniors' homes at this time, no. I mean, we are in the facilities, we're in the buildings, but we do not go into seniors' homes, no.
Okay.
If that's something that, was requested and there were a number of seniors that needed that type of service, then we would have to see, if we could provide that.
I just want to add, if in any senior center is they can come out from the house, they can authorize a family member or someone to come and complete the form for them.
Okay, thank you. I'm all set.
Council President Surgeon.
Just want to talk about the senior the rent rebate program, because we did get a note from your office that there was some sort of communication that is going around that the city come into each person's home, and your office did send clarification that you are in the senior center and you do not go into a person's home.
Yes.
So just wanted to let you know that we did get your notification that, you know, the seniors were thinking that you can come into their home, and you did send that out, and we did clarify that with our staff.
Thank you.
And just one last thing, what are the requirements for a sanitarium? I wanted us to ask your environmental person for a job, if a person was to apply for something like that. That's it, when I'm done.
Sanitarian for the city of Hartford is a minimum of a 4-year college graduate degree, preferably with some heavy science background, but not mandatory. There are the certification for the food service inspections. It includes multiple layers of training, online coursework, shadowing a current inspector, independent inspections that are done under a FIDO, which is a Food Inspector Training Officer, which I have that. They also have to have the Lead Inspector Risk Assessor certification. That's a 5-day course. And there's a refresher every year. They have to be well-versed in basically urban environmental issues for Hartford. I don't know if I'm missing anything.
No, but I just wanted to add usually the time duration besides the actual degree for food safety inspections or for food certification, the average, it usually takes about 2 years to complete that entire process.
And to become a registered sanitarian or a registered environmental health specialist, it's a 4-hour national examination, and that can be achieved after you have to have a minimum of 2 years experience and also a minimum educational qualifications.
Thank you.
Thank you.
All right. I only have 2 questions. Well, I had 3, but Council President stole my question. So now I have 2. On the budget book on page 27-5, there's quite a bit of data that's unavailable. Can you shed some light on why that data is not available? It's mostly in the maternal and child health program.
I'm sorry, can you repeat the question?
So the data that's for 2024 under that division, maternal and child health program, there's quite a bit of data that's not available. Is there any particular reason why that data is not available? It's on the KPIs for that division. I don't know if you have your budget book with you. If
We'll get back to you with that information.
no problem. No problem. My second question, this is an easy one now. The grants that you are waiting for, there's one that you apply already, you're waiting for decision. There's 2 that you're going to apply in the month of May and June. Are those 3 grants already embedded into the budget for next year?
No, they're not.
They're not.
No.
They are not. So if you were to get those grants, that will be in addition to what you already are presenting to us.
Yes.
Okay, perfect. Last question then. I think you may have already answered this a little bit, but these sanitarians, when they go through this process, they come in with a 4-year degree. There's other certifications they need to have. Do we invest in supporting that path of getting those certifications, even after they get hired, and then you escalate them then eventually once their certifications are done? Do we invest in that process?
We do. We actually are the ones paying for that for them to get those certifications.
So they can only come with a 4-year degree in science, preferably, and then that will be enough at least to get them through the door.
Now that's for the trainees. So the minimum for trainees is a bachelor's degree, right? So you don't have to have the 2 years of experience. You don't have to have your certifications as of yet. You just have to have the minimum of the bachelor's degree for the trainee. And then you have, 2 to 3 years to go ahead and, get your certifications. However, if we are hiring directly for a sanitarian or a EHS 1, then they have to come in with the food certification already, along with the bachelor's degree, and we would prefer for them to have at least a year of experience.
Thank you.
You're welcome.
I think we have one more question here to my left. Councilman Mitchell?
Thank you. Just following up about the grants, you mentioned there was one which I think was teen pregnancy that you didn't get.
Yes.
What was the value of that? How much money would that have brought? Even if, ballpark, but
Around 700,000.
thanks.
All right. Well, seeing that there are no more questions, no, you do. Councilwoman Rosado.
I don't know if this was asked before, but with everyone, right, exhausting their ARPA funds, do you have any of your departments that are exhausting any ARPA funds right now?
I'm sorry, can you repeat the question?
So we allocated a substantial amount of money to the health department when the ARPA funds came in. Do you have any funds that are currently being exhausted that you're going to have to try to get funding somewhere else? I don't know if someone asked
I
that
refer
question.
to my financial manager.
Okay. Currently, no, we don't. Actually, we subcontracted with CPA, which is Community Partners in Action. So they operated, and then on a monthly basis, they send us invoices to process.
Wonderful, thank you.
Yeah.
All right, seeing that there are no more questions, this budget hearing for this department concludes. We will be continuing with our second department, Metro Hartford Innovation Services, in about 10 minutes. Thank you very much.
Thank you.
All right. Good evening, everyone, again. Now we're going to start our second presentation of the night. And now we are getting ready to hear from Director Charis Snipes, representing the Metro Hartford Innovation Services Department. Director Charis, the floor is yours.
Thank you. Good evening, Council President Surgeon and council members. Thank you for allowing me tonight to present the MHIS 2025 budget. I have with me, part of my team is here to show support. I have Brett Floden, who's running our presentation, and I have Luther McBride, correct me if I'm wrong, who is a lifelong resident of Hartford. So I just wanted to acknowledge the team. Luther McBride. Yeah. 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 Okay, I'll get started with the MHIS mission. The mission of Metro Hartford Innovation Services is to provide secure, proven, innovative technologies that enhance operational efficiencies while providing convenient access to government and educational information systems for the City of Hartford, the Hartford Public Schools, the Hartford Public Library, and the Hartford Parking Authority. MHIS is currently staffed with, well, not staffed with, but we have 42 full-time positions. Of those 42, 6 are vacant. 3 of those positions have to go to the union because they are brand new positions that's not current within the union. So HR, myself, and the union, we're gonna work together to get those 3 positions added. 1 position is new. We did some creative things in the budget to have the ability to hire a senior project manager to manage our high-level projects. We have a lot of projects like the Wi-Fi project and the fiber project, and we need someone to manage those projects for us. Current staff is doing that, and it's a little bit tedious in doing that and then doing the work as well. We have 2 positions that we are actively recruiting for. One is the executive assistant position, and the other one is a 3rd information security analyst position. So for 2024, I'm going to speak about some of the highlights of projects that was done within MHIS. This is not all the projects, but this is some of the projects that we focused on. We focused on the Select Civic platform. We are happy to say that we finished that project in December of 2023. That included solely of service request management, which is 311, and that implementation was for Public Works, Department of Development Services, HHS, Fire, and HPA. We are currently working with a vendor to create an app for the 311 through Acela, so it'll be more efficient for our residents to be able to report things within the community. Another highlight is we renew our cyber policy at the same limits as last year, with half of the deductible and a 20% discount. This is all due to the security controls put in place within the department. We are currently installing fiber within our parks and our golf courses and some of the public safety locations. So we utilize current budget by switching from cable internet to fiber. So that will allow us to do many things. One of the things that we're looking to do is starting, if we are able to get grants that we're applying for, is to put Wi-Fi in our parks. We currently have Wi-Fi in one city park, and that's Bushnell. That's being utilized by residents today and people that visit the city. And listed is a couple of the locations that we've completed. We've completed fiber for the Goodwin Golf Course, Goodwin Pool, Keeney Golf Course, Friends of Keeney, Metzner Center. We're working currently on police substation in the northwest section, Fire Engine 9, Fire Engine 15, and Colt Park. We just added a connection to the Northwood Cemetery That connection is solely for time clocks. And we're going to be putting infrastructure in there for the use of a computer. To continue with the highlights, we partnered with UConn. The city of Hartford did for Hartford Public School students to bring broadband and computer science to the school. There's a pilot going on, and the application was submitted by UConn on behalf of the city. They chose a neighborhood in the Frog Hollow, but then they expanded it a little to all the students within Hartford. So that was a good pilot that's going on. They provided laptops to the students, and they provided them with hotspots. We also assisted the Hartford Public Schools STEM department with the implementation of their new esports club. So far, that implementation has been successful, so we're proud of that. It took a lot of work, and it was very challenging at some point, but we got through all the challenges, and we're moving full steam ahead with that. We relocated City Fiber to bring internet service to Bushnell Park, providing free Wi-Fi. We assisted HPD with their radio site with the fiber infrastructure to support the new radio communication at Mount Sinai. We continue to assist C4 department in the successful deployment of video cameras across the city by providing the necessary network backhaul connectivity. We migrated the database for the early childhood development centers to Power School, a more secure platform. We migrated the Hartford Public Schools health-based clinics to a new platform that's more efficient and secure that holds student HIPAA information. Assisting the Treasury with the migration of ACI payment methods to Bank of America, continuing to support departments with staff shortages and turnover, converted the civilian complaint reporting database to a new system, and in an effort to align the mayor's initiative of transparency, we created the tax dollars allocation chart where residents can go in and put in their tax dollars to see where their tax dollars are going. MHIS strategic initiatives. The MHIS business strategy encompasses multi-facets and calls out common themes where technology can be an enabler. If we wrap this in a single paragraph, it would be improving city services and creating new possibilities via technology, anytime, anywhere the city needs it. This includes delivering stable, responsive, and available technology platforms that provide the city the foundation needed to deliver effective services with ongoing strategies of cloud, business analytics, and security. Our budget had a 9.4% increase, and the majority of that is due to system maintenance costs. We've seen increases go up in our maintenance agreements, internet and telecom services, our telephones, our provider went up with their costs, and infrastructure support and repairs that we need to for fiber and cabling. And I'll give an example of that one. Whenever there is an accident and a pole is knocked down, we need to be able to provide and pay for the cost to have equipment reinstalled. And one example that just happened was on Nelson and Main Street. So all of our Wi-Fi gear was on the ground. We had to go and get it, and residents came up and they had remarks about it, and some of them was colorful. I'm not gonna say it, but they was like, "If this is this the free Wi-Fi?" We said yes, and they was like, "We use that." I'll say stuff. So they're utilizing that, and they are very serious about having their Wi-Fi back. So we have to make sure we provide the necessary repairs to get that equipment reinstalled. So some of that is in this budget. Our budget highlights are we are hiring a senior project manager, again, due to manufacturer increased costs and vendor costs and increases. The MHIS staff composition for residency, we currently have 8% that are City of Hartford residents. We have 92% that are not. Our race and ethnicity, Hispanic 8%, African American 33%, Caucasian 52%, other 7%, female 16%, but that doesn't mean a lot because the women in department, in our department, we're mighty. 84% male. Thank you.
Thank you,
Be
Director
more than
Snipes.
happy to answer any questions.
Thank you. We're gonna start from my right. Councilwoman Rosado?
Thank you to you and your team for your great leadership. I just have comments. I'm really happy with the work that you do for us. Just saw your email today with Councilman Gale's request for the friendly button on the website, and it looks great. And I just love to just press that button how the meetings come up. So thank you, and thank you to your staff.
Thank you.
Councilwoman Bilodeau?
Thank you for your presentation, and thank you for you and your team's service to the city. Just a quick question so I can understand what migration of ACI payment methods to Bank of America entails.
Yes, so we are not your traditional IT department, right? So we handle transactional data for city financials, right? So this includes, I would just use it as example, city pay, employee pay. We provide that file to the Bank of America every week to make sure that city employees get paid, but make sure that transaction is secure as well. Yep.
Thank you very much.
You're welcome.
Assistant Majority Leader Clark.
Thank you, Sharice, for your presentation. It's always thorough as usual. Just wanted to talk about our infrastructure and how is it beefed up from the malware attack.
So I can talk plainly, but not in detail. So we have put systems and processes in place that will help us identify and see threats. I'm cautious to say before they happen, but we can mitigate those type of threats, and we built resiliency because no one is not susceptible to cyber attacks. So we built processes where we can see certain threats that come in and we can act swiftly on those. I can go into more detail off record because, this is what they do. They're probably listening now because I'm talking. But yeah, we can talk about that. Yep.
Thank you. And my last question is regarding our fiber infrastructure. Are we fully on board across the city?
No. So we are almost fully in the Blue Hills area. We're almost done, if not already done, down Tower Avenue. So we are applying for grants to finish the Wi-Fi project as well as build our own fiber infrastructure to connect the north end to the south end. So we're working on applying for, I think, at least 2 or 3 grants that's available through the state of Connecticut and then the federal as well.
Thank you very much. Thank you, Mr. Chair.
Majority Leader Rossetti.
Thank you. Thank you to your department. Excuse me. I want to build on this guy, Assistant Majority Leader Clark. Question, I forgot his name for a minute. You talked about the malware, but is there something, and it's kind of separate, but I know there may be residents watching, that's new that we should be watching out for? I know you said all the time, but is there something kind of prevalent right now that would be useful, or is coming down the road that we should watch out for?
I think the biggest thing to watch out for is phishing email and spoofing, being tricked into clicking on things. Be cautious of links. If someone send you something, contact that person to ensure that they sent it to you versus clicking on the link. Cyber threats can come through anything. It could be a picture. You click on that picture, it gets sent somewhere else. So I would say phishing is the biggest, and spoofing. Don't fall for the mayor or someone asking for gift cards, right? We're not gonna.
Oh, I know. He asked, Luke used to ask me for gift cards
All the time. Yeah,
It's
yeah.
crazy.
Yeah.
Okay, thank you very
You're
much, and
welcome.
thank you to your department.
All right. Council President Sturgeon.
Thank you, Mr. Chair, and thank you, and thank all your staff for the great job they're doing. I know it's not easy, working for both the board and the city at the same time because of your demand. Guys are really in demand, you know. So thank you guys for the service, and a lot of us were new coming in January, and so thank you for getting us equipment so we could stay in touch and do what we have to do. My only question is talking about Wi-Fi in this building. It's slow.
Yep, it's in the budget.
Oh, all right. Well, thank you very much for that answer. Have a wonderful evening.
Councilman Gale.
Thank you, Mr. Chair. I don't know if I have a question so much as a comment. It was just alluded to by Council President, and you mentioned it in your presentation to some degree. But to the extent that there are people watching, I think a lot of people may not be aware that your department is, I believe, the only department in the city that serves both the city and the Board of Education.
Yes.
And so this is an example of one model for achieving some efficiency where the board doesn't have to have its own separate MHIS and the city have its own separate MHIS. And I assume it looks as though from your numbers that the departments are roughly equal in manpower.
Yeah.
The board's needs are about the same as the city's needs, apparently. So if there's any question in that, I guess it's just to ask you to comment on how you feel that's working out and whether this is, well, just how you feel that's working out.
I think it's working out fine. It's a shared service, and we work across both. There's no one that says, I'm a city employee, I don't do board work. I think it's a cost savings. That's the biggest part of it. The majority of the team wear 3 hats, right? They don't just do one job. They jump in and do multiple jobs. And there's always, room for innovation and to do new things, right? It's been working out fine for us. I haven't heard any complaints about it, so.
Well, thank you, and thank you for everything you do, and thank you for getting that fixed today.
You're welcome.
Councilman Mitchell.
Thank you, Mr. Chair, and thank you and the team. Just another question, couple questions about Wi-Fi. Not in this building, but in the city.
Yep.
What is the extent now of coverage?
So we are currently in the north end and in the Frog Hollow. We currently have, from the last report, over 40,000 residents using the Wi-Fi on a daily basis. Then we also have the separate Wi-Fi in Bushnell Park. That average for the week is about 4,000. It's heavily utilized for many different things. Some people use it for streaming, some people use it for education, some people use it for their financials as well, but it's definitely used. And when we went to go get that equipment, the lady was like, when are you going to replace this? Because we use that stuff.
Right. No, I know that the places where it's at, people love it.
Yeah.
And you said that you're applying for grants to extend to other neighborhoods?
Yes, to finish the project.
And what is the amount of those, what is the cost that you have to get to do that? And if you get that money, what is the time frame for doing it? Just assume, you know, all the money comes, all the grants come in, then what's the implementation period, roughly?
Yeah, so we wanna, we through this whole thing, it was all brand new, and we discovered that fiber is better, right? So we are looking at all of the places where we currently have a little fiber to utilize that. So the ballpark, the last time we did the analysis was about $33 million to do that with fiber.
And if and when you get, I mean, suppose that money came tomorrow,
Yeah.
what's the time, how long does it take once you have the funds to do the work to make it
To finish
happen?
the entire city will be about 3 years.
Okay, thanks. That's all I have.
You're welcome.
Well, thank you. I'd like to start by saying thank you to your department for your support getting bachelor school up and running before a public hearing. I know it was a major task, and it was kind of like almost last minute, and you guys pulled through. I know you guys make Noelia very happy, and if she's happy, I'm happy. And I know you guys were there almost every day for a few days and getting it done, so thank you very much. And this is just a small example of what Councilman Gale was referring to, of that efficiency. I don't know if there was a separate department by the board, I don't know if we would have been able to get the ball rolling so quick. And this is just an example of how the interconnectivity worked out in our favor in this particular case. So thank you very much to you and the staff that worked really hard on making that happen. I only have one question. If you look at the budget book on page 16-2, there's one particular KPI that says number of devices per technician.
Yep.
So the projected number for this year is upwards 5,000, but your projection for next year goes even under 2,000. That's a huge, substantial decrease.
Yep.
Can you shed some light on what that even means and why that's a huge swing?
So these numbers represent both the city and the schools, right? So we go by the school model, and they were 1-to-1. Now they are going to change that from being 1-to-1 to like a modified 1-to-1. So the device will decrease because every student won't have a device, but there will be devices in those classrooms for them to use. So that's what that number reflects.
So that decrease is mostly because of the students and on the side of the board.
Yes.
Oh, thank you. I have no more questions. Is anybody else has any other comments or questions? All right. So seeing none, this concludes this presentation.
Thank you.
And with that, I'd like to remind everyone that tomorrow we'll meet again here at 5:30 for 2 more departments, and they just escaped me, but I believe it's the Department of Children's and Family and the Department of Development Services, DDS, tomorrow at 5:30. This concludes our meeting. This meeting has been adjourned.